In this video, I'm going to talk about broken wrists, better known as wrist fractures, which are such a common problem, particularly when the weather gets colder, the pavements get slippy, and, well, you know the rest. So I'm going to talk about how wrist fractures are managed, particularly from a therapy point of view, in order to help you get your full movement and strength back again as soon as possible. I'm Stephen Bunting. I'm an MSK physiotherapist based in the UK. Welcome to the channel, where we explore the common MSK problems that normal, everyday people experience and the evidence-based treatments that can help. So I'm going to start by explaining a bit about wrist fractures and exactly how they're managed. But if you just want to skip straight to the exercises, then I've put chapters and timestamps in the description below. And just a side note here, because I do get asked this a lot, fractures and breaks are the same thing. Fracture is just the correct medical term for a broken bone, and so that's the term that I'll be using throughout this video. So wrist fractures can come in various different flavours depending on exactly which bone or bones are broken, the type of injury that caused it, and the position that the bones end up in. But by far the most common type is the distal radius fracture, sometimes called a Colles fracture. It's almost always caused by a fall on an outstretched hand. The radius is one of the two forearm bones, and the end nearest the wrist, the distal part, forms the main part of the wrist joint. It most commonly fractures just here, and the fractured part ends up being angled backwards like this. You'll usually know if you've fractured your wrist because it will usually be painful. You won't be able to move it much and it will swell up. You might also have felt or heard the bone break, but not always. A bad wrist sprain can also give similar symptoms, and so if a fracture is suspected, then you're going to need an X-ray. This is what a typical distal radius fracture looks like. Here is the fracture line, and on the side view we can see that the fractured bone is angled backwards, which is the typical position. Now, I did mention that wrists can fracture in all sorts of different ways, and we have names for all the different types. I'm not going to describe them all here because the information in this video is mostly relevant to them all, but of course you will be advised by the medical team that's treating you if your fracture needs a different approach to the standard wrist fracture treatment, or if there are any particular precautions needed in your particular case. So if you've just fractured your wrist, then you're probably going to be in an emergency room or an urgent care centre. Once the fracture has been confirmed on X-ray, then you'll usually be put into a basic cast to keep the fracture still, and then given painkillers. Depending on the severity and position of the fracture, you might be treated immediately, or you might be sent home and asked to come back and see the orthopaedic team in a few days. A decision will then be made as to whether the fracture is treated in a cast for a further 4 to 6 weeks, or whether the bones are fixed surgically using a plate and screws. The decision is usually made depending on the position of the fracture. If it's stable and in a reasonable position, then it's best treated in a cast, but if it's unstable or in a poor position, then it will be treated surgically, as you would otherwise end up with a wrist deformity if the bones go on to heal in the wrong position. Distal radius fractures which have healed in this way may lead to the classical dinner fork deformity. If your fracture is treated in a cast, then the only job you have for the 4 to 6 weeks it's on for is to keep it dry and to keep the fingers, elbow and shoulder moving in order to prevent stiffness. A few times a day you should be wiggling the free joints of your fingers and your thumb, bending and straightening your elbow fully and turning your palm up and down. About 10 times each will do. You then need to be lifting your arm up overhead and out to the side, behind your head and behind your back. Again, about 10 times each will be plenty. If your neck muscles feel a bit tight and achy due to the weight of the cast, then side to side bending and rotation movements can be helpful. If your fracture was treated surgically, then you might also be put in a cast for a few weeks, in which case you should also do the previous exercises. Or you might have been given a wrist splint that you can take off and do some gentle wrist exercises. Whether and when you can start taking the splint off will be different for everyone, so take advice from the surgeon or the therapy team who's looking after you. For most people, this will be when the stitches or staples are removed, usually about 10 days after the operation, but like I said, follow the advice of the surgical team. The exercises you can do out of the splint will be just gentle wrist movements to start with. Simple forward and back movements and side to side movements, trying to keep any pain to a minimum. Some simple finger exercises will help with finger stiffness and keep the tendons moving. Once the stitches are out, then you can also start with gentle scar massage to help the skin heal neatly. With one finger, do firm circular movements along the length of the scar for about 2 minutes and repeat 3 times every day for a few weeks. If the skin is dry, then using a non-perfumed moisturiser whilst doing the massage can also be helpful. Sometimes swelling can be a persistent problem after a wrist fracture. Keeping your hand elevated on a pillow or cushion when resting will help the fluid drain away, and keeping the fingers moving can also help to mobilise the fluid. It's not unusual to get some tingling or pins and needles in the fingers after a wrist fracture, as one of the important hand nerves passes close to the fracture site and can sometimes become irritated. This should improve over a few weeks, but if not, mention it to the orthopaedic team. Now, whether you've had the operation or been treated in a cast, the bones take about 4 to 6 weeks to heal. If you've been treated in a cast, then that's the point when it's usually removed. You can now start exercising the wrist. If you've had the surgery and been using a splint, then provided your surgical team are happy, you can now start pushing the exercises and stretches that you've already been doing a bit further. And so the following exercises should be suitable for all of you at the 4 to 6 week point, whether you've been treated surgically or been treated in a cast. The idea of an exercise program is to hopefully restore your wrist movements and function as quickly as possible. Usually, formal physiotherapy isn't needed, as most people can follow the exercise plan and make progress by themselves. You'll probably be given a simple exercise sheet by the hospital. But if your wrist pain or stiffness is unusually severe, if you developed any complications, or if you just haven't made much progress after 6 weeks, then you might need to see a therapist. At 3 months, most wrists are about 90% better, but still might look a bit thickened. It can take a full year before the wrist feels and looks normal again. However, it's also not unusual for a wrist to remain slightly angled compared to how it looked before. This is because wrist fractures, and particularly the ones treated in a cast, rarely heal in a perfect alignment. This is usually fairly subtle and shouldn't give you any long-term problems, but if you have any concerns about your wrist appearance, then do go and get an orthopaedic opinion. Now, before we get to the exercises, an occasional complication of wrist fractures is that the tendon which moves the thumb tip can sometimes rub against the roughened fracture site and eventually wear through and snap. So if you notice that you can no longer lift up your thumb tip after a wrist fracture, then this might have happened to you. It's not a major problem, but it might need surgical treatment, so you might need to see an orthopaedic surgeon. And the last complication I'm going to mention is a condition called CRPS, which is an abbreviation for Complex Regional Pain Syndrome. This is where the nerves in the hand and wrist become overly sensitive after a wrist fracture, to the degree where the pain becomes severe and can be a real barrier to your rehabilitation and the ability to do the wrist exercises. At some point, I will get round to doing a separate video about CRPS, and when it's done, I'll link to it up here and in the description. Your orthopaedic or therapy team will usually have noticed if you're starting to develop CRPS, but again, if you have any concerns, then do get checked out, as CRPS can significantly complicate and lengthen the rehab process after wrist fracture. Okay, so on with the exercises. Now when you first start to get things moving again, the common areas of pain are around the base of the thumb region and the little finger side of the wrist. This should usually improve over time, but don't push too aggressively into pain whilst exercising. Expect some tightness and discomfort, but any pain during exercise should be no more than about 5 out of 10 on a pain scale and should settle down within about 30 minutes of exercising. Doing the exercises straight after a bath or a shower, or after immersing your hands in warm water for a few minutes, can help reduce any pain or stiffness. The first exercises are for your fingers and thumb. First up is an exercise to help with finger joint movement. Start by making the tightest fist that you can. Hold for a second and then extend your fingers to as straight and wide as you can. Don't worry if you can't get to full range. Your movement should improve slowly over time. Repeat this about 10 times. Next, try rolling up your fingers like this and then pointing them out at an angle like this. And again, repeat about 10 times. This helps with finger tendon movement. Finally, try tapping your thumb tip to each finger individually. If you can do this easily, then try sliding your thumb down the length of each finger like this. Again, about 10 times with each finger is ideal. You should keep doing these exercises about 3 times daily until your finger movements are back to full range. The next exercises are for the wrist, and of course this is the joint that's going to be really stiff and uncomfortable when you first start moving it again. So go easy and progress slowly in baby steps over the coming weeks. First is the one that we call throwing darts. Rest your elbow on a table or chair arm. Grasp a pen between your thumb and index finger and then practice taking your wrist through the action of throwing a dart. As far back as you can to as far forward as you can. Repeat about 10 times. We then need to turn our attention to the main wrist movements of flexion, extension and side bending. To start off, we can do these movements actively about 10 times in each direction. When we can do this with minimal pain, then we can start adding a gentle stretch to the end of each movement, like this. Try to keep any pain to below 5 out of 10, as we mentioned earlier. The other important movement that becomes stiff following a wrist fracture is forearm rotation. This is best done on a table or the arm of a chair. Slowly turn your palm from the downwards position to the upwards position as far as you can within our 5 out of 10 pain limit. Hold for a few seconds and then turn back down as far as you can in the other direction. If the movement is stiff but not too painful, then you can add a stretch by using your other hand. Again, see if you can repeat about 10 times in each direction. When you can do all these movements with minimal pain, then it's time to progress. For wrist extension, we can do the prayer stretch. Look at the position of the forearms and aim to get them level over the coming weeks as you progress. Hold this stretch for 15 to 30 seconds and repeat 2 to 3 times. If you feel you need a bit more leverage to increase the stretch, then try stretching your wrist against a wall like this. Keeping your palm flat against the wall, slide your hand down until you feel the stretch. Hold for 15 to 30 seconds and repeat 2 to 3 times. To progress further, you can do the same stretch using a table or in kneeling by using the floor. Adjusting how much of your body weight goes through your wrist will help you find the right level of stretch. For wrist flexion, the best stretch is to support your forearm on a table with your wrist draped over the edge. Then use your other hand to stretch into flexion. Hold for 15 to 30 seconds and repeat 2 to 3 times. To progress forearm rotation, you can use something like a rolling pin or a hammer in order to add some stretch at the end of the movements. Again, hold for between 15 and 30 seconds at the end of each movement and repeat 2 to 3 times. At about 10 to 12 weeks after your injury, you should be making good progress with your range of wrist movement and the pain should be minimal. You can now start to add strengthening exercises. Start by doing some isometric exercises, which involve contracting the muscles but without any movement occurring. You do this by applying resistance with your other hand. For wrist extension, place your forearm on a table or armrest. Bend your wrist backwards and then try to keep it still whilst applying downwards pressure with your other hand. Hold for about 5 seconds and then relax. Repeat 5 to 10 times. You can do the same for wrist flexion. For forearm rotation, start by turning your palm downwards and then pin it in place with your other hand. Now try to turn your palm upwards while resisting the movement with your other hand. Hold for 5 seconds and repeat 5 to 10 times. Then do the reverse movement by holding your wrist in the palm upwards position and then trying to turn it downwards whilst resisting with the other hand. No movement should occur whilst doing these isometric exercises. For most people, the exercises we've gone through so far should be sufficient to get your wrist back to full strength and function. But if you're trying to return to sports, the gym, or some other strenuous activities, then the following exercises will help to take your wrist strength to the next level. The next set of exercises can be done with a dumbbell or a length of resistance band. Wrist extension can be done like this, with your palm facing downwards and forearm supported. Take your wrist slowly upwards, hold for a few seconds, and then slowly downwards in a smooth, controlled movement. Repeat 10 times. Wrist flexion can be done in the same way, but with the palm facing upwards. To improve grip strength, you can use a resistance ball. Squeeze it with your full hand to strengthen your power grip, and then indent it with your thumb and individual fingers to strengthen your pinch grip. Hold each movement for about 5 seconds and repeat 10 times. Finally, to help with wrist weight bearing, you can do various combinations of the press-up exercise. Start with stability work and the Superman exercise. Adopt the kneeling position and then take your opposite hand and foot off the floor. Hold for a few seconds before swapping sides. Do the movement slowly and controlled. To progress this, you can do a stepped weight bearing exercise like this. Start with knees on the floor and progress to the press-up position. The last exercise I'm going to share with you should help restore your full confidence in your wrist. It's a plyometric exercise that involves sudden loading of the wrist followed by an explosive push-up. Start against a wall, fall forwards, catch your fall with both hands and then push strongly back into the standing position. Progress by taking more weight through the affected wrist or by using just one wrist only. It's also harder the further you stand away from the wall. And you can also do this against a table. Okay, well that's about it. I hope you found the video helpful in guiding you to a full recovery after your wrist fracture. So good luck with it, thanks very much for watching, and bye for now.